Hello, everyone, and welcome back to The Wrap, brought to you by Michigan Medicine Headlines. I'm Dan Ellman with the Department of Communication. I'm joined today by Kelsey Stratton, the Program Manager for Resilience and Wellbeing Services and a clinical psychologist in the Office of Counseling and Workplace Resilience. Kelsey, thank you so much for being here.
It's great to be here.
Now, as you can see, or maybe not if you're listening to the audio-only version of this podcast, we're taking a different approach to The Wrap. In the spirit of social distancing, we are chatting with our guests via a live stream as we work to flatten the curve of COVID-19. Because of that, this and other upcoming episodes of The Wrap will be found on YouTube, along with iTunes, Stitcher, Google Play, and any other podcast hosting platform. You'll also find it as part of the Headlines Week in Review. Okay, Kelsey, now you're here today to talk about an extremely important topic: protecting your mental health during the COVID-19 pandemic. Obviously, this is a challenging time for everyone at Michigan Medicine. For those on the front lines of patient care, what sorts of tips would you offer that they can help carry out to manage their mental health?
So, first of all, just want to acknowledge the incredible dedication and commitment of all of our healthcare workers. It's a really extraordinary time, and the work is also very extraordinary, and the demands are very extraordinary. And so, when I think about managing our mental health, first and foremost, it's about awareness and being able to acknowledge it. So being aware that because this is a time of heightened stress, of crisis, that our emotions and our responses are going to be different. So it's okay to feel anxious, afraid, to be angry, to be sad, to have less patience, to not be sleeping as well, to feel tense. That's a completely normal response to what is a really atypical situation. And so when we can be aware of that, it helps us normalize it a little bit, which can be really helpful just for feeling maybe not quite so unfamiliar or so alone with what we're going through. And then to acknowledge it is to kind of give ourselves permission that it's okay to feel this way, because again, it is such a different time for many of us. And so to acknowledge our emotional responses and to be more in tune with what we might need. So really setting an intention to take good care of ourselves, to check in with ourselves, to keep that foundation and making sure we're eating, we're drinking water, we're getting rest and sleep, physical exercise, which can be really hard to do when there are a lot of demands placed on us. But
Right.
given the stresses, so much more important to set that intention, to take some of that time for caring for ourselves and the people around us.
And it's not just sort of added stress, but you're sort of out of your routine, right? Even if you're going to work at the hospital right now, it's probably a different routine than you're used to. Or if you're working from home, it's a different routine. So I think that probably plays a big um, part of it as well.
Absolutely. And our personal routines are disrupted. I think for many people, we take a lot of comfort in those routines. And when they become disrupted, it can feel really uncomfortable. And so making time to acknowledge that and again, recognize that it's normal to feel this way. And that there are lots of supports and resources available to help people through this.
So, talking about those resources, what are some of the Michigan medicine programs or teams that are in place to help them?
Right. So we are so blessed to have an amazing group of volunteers and mental health professionals and colleagues here who have generously offered their support. So we have the COVID-19 stress resource team that's part of a larger unified mental health team that consists of our partners with the Office of Counseling and Workplace Resilience, the Wellness Office with our departments of spiritual care, social work, psychiatry, psychology, many others. And we are working together to provide a broad network of support to all of our faculty, staff, and learners in Michigan medicine. So that includes everything from in-person visits around the hospital. So we have some teams who are in care areas, for instance. We also have virtual support available. So that could be individual sessions or contacts, or group sessions that are facilitated for discussion and skills. We also have some learning opportunities. So learning about coping, about stress, family, parenting concerns, new routines that are coming up. So we're all working together to have this coordinated stress resource team.
Outstanding. Now we touched on this a little bit, but working from home, and we have thousands of employees who are doing that right now, that presents its own unique set of challenges. You've sometimes got childcare to worry about, other sorts of family obligations, just different home life. How can staff members who are working from home cope or adapt?
Yes. So it's a time of huge change, and recognizing whether we live alone or with others that everyone is experiencing quite a big disruption to their schedules and routines. And so I think about this in the sense of how can we focus on what we do have some control and influence over. So perhaps it is setting a routine for ourselves. It might be about how do we practice compassion and self-compassion, that not everything is going to be perfect, that
Right.
flexibility, maybe a little sense of humor about some things, recognizing that we're trying to do the best that we can, and the people around us are trying to do the best that they can. And so, can we have a bit more of that patience and compassion for ourselves and for other people? There are also a lot of resources, especially when it comes to, I think, about families and children who are now home from school. So, resources available that we have online on our website that can direct people to ideas for how to create some structure, how to talk with kids about the stress of the pandemic, how to talk to again, our families and our friends. And then also some of the creative ways that we can cope and adapt by using technology and different resources online. That this time is requiring a lot of creativity, and there are a lot of resources that can help guide us through it as well.
So, at a time of stress like this, it's really easy to focus on the negatives, right?
Mhm.
But there probably are some positives that people should be able to take away and look for, and that's a huge part of self care. What are some of the positives that employees can look to really start to feel a little bit better about the way things are going?
Yeah. So I've heard some really incredible stories about communities coming together. I think about the generosity of our community in providing services, their expertise, their time, material resources, food, that people want to help in a crisis. And, whether it's in your neighborhood or your extended social network or your work colleagues, how people come together and support each other. It gives a sense of hope, and to be able to look forward to what do we get from this, what do we have to look forward to. It's a stressful time, and there is a lot of loss and sadness, and yet we can also hold the idea that people are coming together, experiencing this together, that as a community we will also heal together.
Hmm. And as a community, we are, as one, feeling this stress and anxiety, right? As Michigan medicine as a whole, as a community, as a state, as a nation, as a world as a whole.
Mhm.
So, when you're feeling stress, when you're feeling anxiety, you're not alone. Can you talk a little bit more about that and why employees should really recognize that in themselves, that they aren't alone in this and that others share their concerns and their stress?
Mhm. I think just what you mentioned. So it's completely normal in a stressful situation, in a crisis, to experience increased stress and anxiety. There are some very common ways that people experience stress and anxiety. I also recognize that there are very unique and individual factors too, again, based on um, someone's experiences and their access to resources. So recognizing that piece of it. Um, but what I'll say is that you're not alone with stress and anxiety, and that there are a lot of resources to help you. So whether that is using some of the self-directed resources that we have on our website, reaching out to talk to someone in person, it can be just a very informal discussion about how you've coped. How do we reconnect to our resilience that we have within us, but also
Hmm.
around us in our community and relationships. Of course, if someone is really struggling, if it's hard to maintain work or relationships, kind of day to day activities. And certainly, if someone is having thoughts about harming themselves or someone else, and that's a sign to reach out right away for additional
Hmm.
support. So, recognizing that piece too, part of being aware of our emotions is knowing when they might start to feel more that we can cope with. And there are many resources available.
So, if people want to take advantage of the resources your team or some other teams around Michigan Medicine offer, how can they get in touch with your team?
Right. So the simplest and most direct way is to call 734-763-5409. That is the number that will connect to the stress resource team, and our wider unified mental health group.
Outstanding. Well, thank you so much, Kelsey, for sharing this incredibly important information. If you want to learn more about mental health resources available to cope with COVID-19, check out this week's story at mmheadlines.org. That's mmheadlines.org. And there were a few other important and uplifting stories at Headlines this week. For instance, readers got a closer look at Leo, the new canine security officer at Michigan Medicine. There was also heartwarming notes of gratitude from the Ann Arbor community directed at those on the front lines for all they are doing for patients and families. You can find those stories and loads of other COVID-19 resources at mmheadlines.org. All right, it wouldn't be the wrap without a trivia contest. Last episode, we asked listeners, where is the newest 24/7 market located on the main medical campus? The answer is UH South. Congratulations to Brenda Nimke, who sent in the correct answer. Brenda, a member of the Department of Communication, will help you claim your prize. Now for this week's question, here's Kelsey.
Thanks, Dan. This week's question is, what is the name of the new team created to offer support and consultation for employees during this time of heightened stress? So once again, what is the name of the new team created to offer support and consultation for employees during this time of heightened stress?
Once you know the answer, email it to headlines@med.umich.edu for the chance to win a great prize. And everyone who sends in the correct answer will automatically be entered into a raffle to win an Amazon Echo. Thanks again, Kelsey, for joining us, and a heartfelt thank you to all of our listeners and viewers for everything you are doing for patients, families, and each other. We'll see you next week.